This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks so much for joining us for USVI News. I'm Emily Matson. Thursday was World AIDS Day, and gatherings nationwide marked the 34th annual day to raise awareness to HIV and AIDS and mourn those who have died from the disease. One of those gatherings happening Thursday night on St. Croix. The event, titled World AIDS Day, A Rose is Still a Rose, Art in Motion, Ending the HIV/AIDS Epidemic Through Fashion, was hosted by Frederickstead Healthcare and the Virgin Islands Department of Health. Models donned red on the stage while the announcer gave various facts about the epidemic in order to educate and raise awareness and offer support. According to the World Health Organization, roughly 38 million people are living with HIV, 1.2 million of them in the United States. This was an important event on St. Croix to bring people together in recognition of World AIDS Day. Despite the significant progress being made in detecting and treating HIV, inequities still exist in accessing care. Equal access to testing and treatment was the theme of this year's World AIDS Day.
Today we remember those who we have lost, and we stand with the community in the fight for the health and well-being of those with HIV in the Virgin Islands and around the world. It is important for us to reflect on those who we've lost to HIV epidemic and recommit to the hard work of ending this disease. And yet the HIV epidemic rages on, and we ask, why is that? And this is basically because of equity and the lack of equity. Health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other social determined circumstances.
There are people who are living with HIV every day, and we want to remember those individuals who are still living, and there are more who's going to continue to live long and healthy life because we're providing superior care here in the U.S. Virgin Islands. And we also want us to remember those who have passed on.
The Biden administration is launching a 5-year plan to fight AIDS at home and abroad, which includes closing equity gaps for certain groups, including adolescent girls, young women, and children. Here's more on how far we've come in AIDS treatment and prevention and why there's still work left to be done.
Advances in treatments have led to fewer deaths from AIDS since the beginning of that pandemic, but this disease is still around.
For a lot of people, HIV is almost an invisible condition. But what we know is that, we still have over 30,000 new infections in the U.S. every single year.
Dr. Carlos Mavistutos treats HIV and AIDS patients at Ohio State's Wexner Medical Center. He says awareness remains critical as many people are living with HIV and don't know it.
You can trace 40% of new infections to people who actually were unaware of their own diagnosis.
Mavistutos says we now have the tools to help prevent HIV infection in those who are at risk, and treatments are now available, which allow for people who have the disease to live normal lives.
Even though we don't have a cure yet, as long as somebody is keeping up with their treatment, then they can manage it perfectly well.
However, work still needs to be done. Mavistutos says we need to normalize testing and make sure all people are able to get HIV care.
If we don't ensure access, equal access for everyone with HIV, then we will not be able to end the pandemic.
HIV can affect anyone regardless of their sexual orientation, race, gender, or age. The CDC says talking openly about HIV, getting tested, and knowing your HIV status can help in the fight against AIDS. As we round out the week, COVID-19 case counts remain steady territory-wide. According to the VI Department of Health, there are currently 44 active cases, with 27 on St. Croix, 16 active cases on St. Thomas, and 1 active case reported on St. John. The VI Office of Veterans Affairs is hosting vaccination booster shot clinics and a Veterans Town Hall next week. It's in collaboration with the VA Caribbean Healthcare System. On St. Thomas, the in-person vaccine clinics will be on December 5th and 6th at the SFC Leonard B. Francis Readiness Center, the Armory, from noon to 3 on the 5th and from 9 a.m. until 3 p.m. on the 6th. On St. Croix at the American Legion Post 85 in Christiansted on December 8th from 9 in the morning until 3 and on the 9th from 9 until noon. Veterans, their dependents, and veterans caregivers are eligible to receive the vaccination booster. While walk-ins are welcomed, veterans are encouraged to contact the VA community-based outpatient clinic in their island district to make an appointment. And the in-person Veterans Town Hall will focus on the PACT Act. That's the landmark legislation which could positively impact millions of veterans, their families, and survivors, as it is the most significant expansion of veteran health care and benefits in decades. The town hall is going to be taking place on St. Croix Wednesday, December 7th at the American Legion Post 85 in Christiansted from 6 p.m. until 8 p.m. All veterans are welcome to attend, as well as all veteran service organizations. 'Tis the season for holiday stress. A new poll from the American Psychiatric Association shows many Americans are preparing to be stressed out this holiday season. Jared Hill reports.
The holidays are filled with cheer, but they also come with a lot of stress. A new poll from the American Psychiatric Association finds nearly a third of adults expect to feel stressed this holiday season. That's up from last year.
Stress can come with occasions that we really look forward to, as well as things that we're dreading. Having holidays that are going to come back in full swing that people are looking forward to is also leading them to be more stressed.
The top stressors, affording gifts and meals and finding and securing those gifts. It's something New York mom Jessica Lokatz knows all about.
Financially, it's a little tougher. Gifts are a lot more expensive.
There's some strategies Americans can use to reduce the financial burden by sharing the cost of the holidays. Have gifting groups or have gifting pools or have potluck meals.
APA President Dr. Rebecca Brendel adds being prepared is essential to reduce stress.
To look at which are the things that we feel obligated to do out of our relationships and our familial commitments, and which are the things that we're really, really looking forward to. The rest of them, they might be optional, and we could even say no.
COVID-19 is not as big a worry this holiday season. The poll shows that adults are less concerned about spreading or contracting the virus at holiday gatherings. Rachel Garcia is embracing the season.
That actually we get to get out and be around people and enjoy all the shopping and everything.
And while the poll shows many Americans are looking forward to seeing loved ones this year, Dr. Brendel says it's important to stay home if you're sick so you don't make the holidays more stressful for someone else.
The poll also shows parents are more likely to say they anticipate experiencing more stress this holiday season. On St. Croix, there will be a huge produce distribution drive for UHC-covered GVI retirees. United Healthcare Wellness Program has teamed up with Rogers Farm for the 2022 Wellness Program for GVI retirees. Bags of fresh produce will be distributed on a first-come, first-served basis while supplies last. There will be 500 bags available for the giveaway. It's set for Saturday, December 10th from 1 to 3 in the afternoon at the St. Croix Educational Complex. The St. Croix retirees enrolled in the United Healthcare Plan have to bring their valid member ID card to receive one of those produce bags. The nation's largest online retailer says this year's Thanksgiving weekend was its biggest ever. Amazon reported a record-breaking holiday shopping weekend with its customers buying hundreds of millions of products between Thanksgiving and Cyber Monday. Its top-selling items included tech, card games, and entertainment devices. Amazon did not provide a total sales figure for the weekend, but do note that shoppers generated more than $1 billion in sales for small businesses in the United States who sell on its Amazon site. So you've heard of shrinkflation and maybe greedflation before. Well, here's another one to add to your vocabulary: tipflation. Shoppers report seeing more and more tip requests in more unusual places. As Isabel Rosellas reports, you might not be able to escape it while holiday shopping, even from your own home.
I actually prefer not to call it tipflation, but a tipping invasion.
It's the unwelcome shopping surprise that has social media buzzing.
18% gratuity is already included in the bill. Girl, it's water.
Tips, a staple of the service industry, now extending far beyond.
In the drive-thru, and they've been asking for a tip.
On TikTok, you'll quickly find folks aren't too pleased about it.
Ordering it online myself, Says, would you like to add a tip at the bottom? A tip? For what?
That's a little too crazy for me, and I refuse.
So what's the deal?
The wage moving I see becoming more widespread.
Professor Depayam Biswas has studied tipping for a decade. He says this new tipping trend started with the boom of digital kiosks. Then the pandemic plus inflation
Added fuel to that fire.
more businesses allowing tips to make jobs more lucrative at your expense.
That's my biggest worry, that it might actually affect the industry where it really matters the most.
This is Mr. Manners.
The very concept of a tip is that we are rewarding a service employee who's being paid less than minimum wage.
Thomas Farley has a tip without hesitation list, and just 3 people make the cut: servers, bartenders, and washroom attendants.
I really wonder, where's the line? It has accelerated beyond all of our wildest nightmares.
To avoid tipping, pay cash. But if plastic is a must,
You need to own your position. You do not need to feel guilty about it.
there's power in saying no.
Now that's worth a tip.
I'm Isabel Rosales reporting.
I might add to the must-tip list, of course, those at the salon, hairstylists, and those who get your car, too, when you drop it off and pick it up, valet.